Today, let's learn something about Chapter 12 Psychiatric Disorders. Like many health conditions, psychiatric disorders can be caused by multiple factors. Genes often play a role, with many psychiatric disorders tending to run in families. Yet having a close relative with anxiety, schizophrenia, depression, or another psychiatric condition does not mean that you will develop the same problem. Many environmental effects, including life circumstances, medical conditions, and personal relationships, also have an influence. Environmental factors can be negative, like the death of a loved one, poverty, addiction, or being exposed directly to violence such as military combat, or they may be protective. These so-called resilience factors include a strong support system of family and friends, good coping skills, being physically active, and involvement in a range of activities. The first we are going to introduce is called obsessive-compulsive disorders. It's also called OCD, and OCD is a common chronic condition aptly named for its symptoms: uncontrollable recurring thoughts and repeated behaviors to banish, relieve, or compensate for the obsessions. OCD affects about 1% of U.S. adults, with an average age of 19 at diagnosis. Obsessions vary widely. A person may, for example, worry about getting sick from a contaminated object, or feel the need to be perfect all the time. Compulsions attempt to counteract those thoughts behaviorally, for example, by excessive hand washing or constantly checking for mistakes or problems, such as leaving appliance on. Another type of OCD is hoarding, provoked by the fear of losing or forgetting important information after discarding something. People with OCD are burdened by their obsessive thoughts and, although compulsive disorders can provide relief, they do not bring pressure. Research studies that examine the brain with powerful imaging tools have enabled neuroscientists to define the brain regions involved in obsessions and compulsions. One such region, the basal ganglia, connects with the cortex to help control our ability to move and think, but it also helps us conduct routine behaviors that we call habits. The basal ganglia are also involved in the brain's reward system, our ability to feel good, and in learning and memory. These functions are mediated by the neurotransmitters dopamine, serotonin, and glutamate, respectively. Reward systems are often dysfunctional in people with psychiatric disorders, addiction, or both. Researchers suspect that disrupted signaling between the basal ganglia and the cortex could set the stage for ritualistic behaviors. Studies of repetitive behaviors in math have revealed electrical activity that starts and ends in nerves that connect those two brain regions. The ability to manipulate or override those circuits may point the way to breaking the obsession-compulsion cycle in people with OCD. About 70% of people with OCD obtain limited relief with medication, primarily SSRIs, but at higher doses than are used for depression therapy. If SSRIs do not work to control OCD, other approaches include medications such as some drugs and both of which have significant side effects. Cognitive behavioral therapy, a form of counseling, can also be useful. Deep brain stimulations, also called DBS, is a therapeutic approach used for people with OCD who do not respond to standard drug or behavioral treatments. DBS was first used about 30 years ago to treat movement disorders like Parkinson's disease, but is now being investigated for other uses. In DBS, electrodes implanted at specific brain locations emit high-frequency electrical pulses intended to reset abnormal neuronal firing. Scientists are beginning to explore the use of DBS in the basal ganglia and several other brain regions to alleviate the symptoms of OCD. And the second disorder that we are going to talking about is panic disorder. Panic disorder is a type of anxiety disorder characterized by sudden, unexpected bouts of intense, irrational fear or frightening physical symptoms such as difficulty breathing, a racing heart, sweating, and dizziness. It is more common than OCD, affecting 2.7% of U.S. adults and about the same proportion of teens. Panic attacks typically last several minutes or sometimes longer. Because attacks occur unpredictably, people who experience them often live in fear of having an attack in public or while driving, further increasing their anxiety. About half of people with panic disorder also have mood disorders such as depression or bipolar disorder, as well as other psychiatric illnesses like OCD, phobias, and schizophrenia. Panic disorder is usually treated with psychotherapy, medications, or a combination of this. SSRIs are the primary drugs used for panic disorder, although benzodiazepines can be used in emergency situations. And the third one is called post-traumatic stress disorder. It's also called PTSD. PTSD is somewhat unique among psychiatric disorders because it has a well-defined cause. A harrowing traumatic event such as military combat or natural disaster, a terrorist attack, a serious accident, or physical or sexual assault as a child or adult. PTSD can arise quickly after the distressing event, but sometimes it can take months to years for symptoms to emerge. Symptoms are often severe enough to interfere with relationships or work. Some people have PTSD for many years, experiencing flashbacks and nightmares, intrusive memories of the traumatic event, and hyperarousal, feeling uneasy or angry. To compensate, individuals with PTSD try to avoid trigger situations but nonetheless may experience memory loss, feelings of blame, and decreased interest in everyday activities. Currently, cognitive behavior therapy is thought to be the most effective treatment for PTSD. Neuroscientists have discovered Neuroscientists have discovered physiological changes in people with PTSD. These changes include increased heart rate and heightened electrical sensitivity throughout the skin, and on the face of response to audio or radio triggers of traumatic senses like gunfire or other violence. Simply recalling the initial traumatic event can also bring these symptoms. Another hallmark of PTSD is shallow sleep with increased periods of rapid eye movements, which can lead to sleep deprivation over time. The body's general response to stress is maximal in PTSD, with altered levels of hormones such as cortisol and norepinephrine. The primary fuels in the fight or flight response to danger or fear. Not surprisingly, PTSD treatments include drugs that block norepinephrine, such as the blood pressure medication and beta blocker drugs like propofol. Scientists have also detected low levels of other neurotransmitters, such as serotonin, in people with PTSD, leading to the use of SSRIs for treatment. The neurotransmitter neuropeptide Y also appears to offer some protection against developing PTSD. Neuroimaging studies have begun to reveal the neurobiological signatures of PTSD, including changes in brain structure, and many people with PTSD have a smaller integral hippocampus and smaller prefrontal cortex. In contrast, the brain's emotional center, the amygdala, is apparently overactive in responding to stimuli in people with PTSD. And the next disorder we're going to talking about is major depression. Diagnosis of major depression is based on a set of criteria and that have persisted for at least 2 weeks. And these criteria include feeling empty or sad, loss of appetite, and problems with sleep, and changes in appetite or weight. Like anxiety, major depression is a common psychiatric disorder that contributes to considerable disability and death worldwide. Often depression is accompanied by other diseases. Various medical and psychiatric conditions are common in people who are depressed, and depression can make the other problems worse. Nearly 7% of American adults, about 60 million people, have experienced at least one major depression episode in the past year. At, and 7 out of 10 of these are likely to be female. This striking sex imbalance is not thoroughly understood, but is an area of active research. Several factors combine to cause depression: genes, biological risk factors, environmental triggers, and psychological influences. Many people develop depression in response to the stress of difficult life experience or disabling medical problem, such as cancer or chronic pain. Inside the brain, depression appears to disrupt the hormones that, via the pituitary gland, tells the adrenal cortex to produce more of the stress hormone cortisol. As And some cases of depression, typically those evoked by a stressful incident, situations, or short-term illness, respond to treatment and symptoms go away. In many cases, though, depression becomes a chronic condition and depressive symptoms persist without any outside influence. As was also observed In people with PTSD, people with depression tend to have a smaller hippocampus and prefrontal cortex. This two brain area helps manage stress, but can be damaged by excessive stress. When researchers showed negative pictures to depressed individuals and looked for brain activation, they noted activity in parts of the cortex linked to the limbic system. Even though the burst of activity soon died down, individuals who showed greater activation were more likely to have worse depression 18 months later, such as imaging techniques may help identify individuals at risk for relapse. And people with depression tend to receive cognitive behavioral therapy, often in combination with medications, and is also effective in people with depression. And this type of counseling works to change thought patterns and reroute negative dysfunctional thinking. And the next part is called bipolar disorders. And people with bipolar disorders experience very intense mood changes. Their moods swing between extreme highs and severe lows, each lasting anywhere from a few hours to several months. High or manic episodes involve boundless energy, racing thoughts, and insomnia. They may also involve substance abuse and harmful behaviors like risky sex or other unsafe activities. During low or depressive episodes, people with bipolar disorder feel very sad and helpless, worried, and sometimes suicidal. And the last part is about schizophrenia. Schizophrenia is a lifelong severe psychiatric disorder that seriously disturbs thinking, emotion, and behavioral. People with schizophrenia appear to have lost touch with reality. They experience positive symptoms such as delusion and confused thinking, and negative ones, including an inability to experience pleasure and a severe lack of motivation. Like many psychiatric disorders that first emerge when the human brain matures in the late teens and early 20s, schizophrenia usually appears between age 15 to 25. This time period corresponds to development of brain's prefrontal cortex. Although no cure exists for schizophrenia and many symptoms do not respond to treatment, some people can pursue personal and professional life goals with the help of medications, behavioral therapy, or a combination of this. And that's all about this chapter.